Hello, my name is Jones Muner. Today, we discuss policy development. Definitions. 1. A policy is a general plan of action used to guide the desired outcome. It is a guideline or rule used to make decisions. 2. Policy development is the decision process by which individuals, groups or institutions establish policies pertaining to plans, programs, or procedures. 3. Policy analysis involves the systematic comparison and analysis of a set of policy alternatives to determine which option is most likely to achieve a set of objectives. Health policy. Health policy can be defined as the decisions, plans, and actions that are undertaken to achieve specific healthcare goals within a society. According to the World Health Organization, an explicit health policy can achieve several things. It defines a vision for the future, it outlines priorities and the expected roles of different groups, and it builds consensus and informs people. 5 health-related policies in Zambia. Healthcare policies includes 1. HIV workplace policy. 2. Malaria treatment policy. 3. Infection prevention policy. 4. TB treatment policy. 5. HIV post-exposure treatment policy. 6. Public health policy. 7. Mental health policy, 8. Healthcare services policy. 9. Personal healthcare policy. 10. Pharmaceutical policy. 11. Vaccination policy. 12. Tobacco control policy. 13. Breastfeeding promotion policy. Let us now discuss some 5 reasons why it is important to have policy regarding healthcare, or the purpose of a policy. The purpose of a policy or healthcare procedure includes 1. To provide standardization in daily operational activities. 2. Policies and procedures provide clarity when dealing with issues and activities that are critical to health and safety, legal liabilities and regulatory requirements that have serious consequences. 3. Policy is also used to communicate to employees the desired outcomes of the organization. They are usually broad, state what has to be achieved and why, and answer major operational issues. 4. Policies again can help employees understand their roles and responsibilities within the organization. 5. Policies generally to help them run organizations efficiently in achieving their objectives. 4 steps that are involved in policy development. To appreciate this, we look at process of policy development. Mnemonic, F.I.E. There are 4 typical and main steps in the policy development process. 1. Identifying a problem. 2. Formulating a policy. 3. Implementing the policy change. And 4. Evaluating the result. Each step is usually followed in the order listed to make sure that the process is done correctly. 1. Identifying the problem. The first step in the policy process is to outline the problem, since a policy is usually developed to provide solution to identified problem. This involves not only recognizing that an issue exists that needs to be addressed, but also studying the problem and its causes in detail. This stage involves determining how aware the public is of the issue, deciding who will participate in fixing it, and considering what means are available to accomplish a solution. 2. Formulating a policy to resolve the problem. After identifying and studying the problem, a new policy may be formulated or developed. This step is typically marked by discussion and debate to identify potential obstacles, to suggest alternative solutions, and to set clear goals and list the steps that need to be taken to achieve them. Once the policy is developed, the authorities must agree to it. 3. Implementing the policy. This is the step of actualizing the policy. A new policy must be put into effect to address the identified problem. This step also involves communicating the new policy to the frontline implementers as well as supervisors. Coordination, as well as sufficient funding, are also needed to make this step a success. 4. Evaluating the effect of the policy. The final stage in the policy process, known as evaluation, is typically ongoing. This step usually involves a study of how effective the new policy has been in addressing the original problem, which often leads to additional policy changes. It also includes reviewing funds and resources available to ensure that the policy can be maintained. Historically, this step has not always been treated as very important, but policymakers are increasingly finding ways to make sure that the tools needed for evaluation are included in each step of the policy process. 5 methods of policy analysis. The following is a review of the most prominent methodologies used in policy analysis to describe, analyze, and compare policies. 1. Needs assessment. This involves identifying the nature, scope, and extent of the problem, whether the current policy addresses the problem adequately or not. An assessment of the extent of need in a variety of ways is made, and the nature of the problem through analysis of existing information. This information is used to describe the current state of need and to forecast likely needs. 2. Cost-benefit analysis. Cost-benefit analysis is an approach that attempts to relate the direct and indirect costs of policies to the direct and indirect benefits of those policies. Cost-benefit analysis requires that both the costs and the benefits of policies be calculated in monetary form. This is frequently difficult to do because policy analysts are often unable to give a precise dollar figure for saving a life, for example. 3. Cost-effectiveness analysis. Cost-effectiveness analysis looks at the costs of different policies in achieving the desired policy results. Unlike cost-benefit analysis, this methodology does not require the monetization of the benefits of each policy. Although policy analysts may not know the dollar value of certain benefits, they can compare which policy costs less to achieve the same desired outcome, regardless of monetary value of the expected benefits. 4. Outcome studies. Outcome studies document the comparative effectiveness of different policy alternatives. Policy analysts are able to assess the extent to which some policy intervention has had the intended impact on the problem it was designed to address. 5. Case studies. Case studies involve the systematic and detailed description and analysis of the formation, implementation, and evaluation of specific policies. Examples include analysis of the impact of the Zambian health policy on access to health. 6. Meta-analysis. Meta-analysis uses a statistical approach to combine the results from multiple studies in an effort to increase power over individual studies, improve estimates of the size of the effect, and/or to resolve uncertainty when reports disagree. Meta-analysis can provide guidance to policymakers in the early phases of policy development by summarizing existing quantitative studies and can assist them after a series of policy outcome studies have been conducted. This concludes our discussion for today. Remember to subscribe to my channel and thanks for listening.